Chilly in here. It's chilly. Good afternoon, everyone. Good afternoon, Rhode Island, and thank you for tuning in to our Wednesday at 1 o'clock coronavirus press conference. As a reminder, I'm here every Wednesday at 1 o'clock, and I'd encourage you to tune in. If you can't, please sign up for your own email. You'll get a daily email. Because we are at a critical juncture with coronavirus and we're trending in the wrong direction, I've decided also to have a press conference tomorrow at 1 o'clock because there's a lot of information that I need to share with you and some new restrictions. So this week, 1 o'clock today, and again, 1 o'clock tomorrow. So please try to make an effort to tune in tomorrow at 1 o'clock. Okay, we have a lot to get through today, so I'll begin as we always do with the data, and I'll ask you please to put that up on the screen, put the dashboard on the screen. I want to spend most of our time today unpacking the data and what we are seeing in Rhode Island as it relates to the coronavirus. And I'll begin by saying it's not great news. It's not great news, and I need everybody to pay attention and focus because we need to get ourselves back on track. So what I'm about to share and the information before you is meant to be a bit of a wake-up call for all of us to say, okay, I need to become more vigilant. So yesterday we performed 6,000 tests and we saw 160 new cases. That yields a percent positive of 2.7%. That's too high, nearly 3%. That is not where we want to be. In the last week, we've seen several days over 2% for the first time in months. And so we have to watch it closely. In fact, other than in these past couple of days, the last time we had a percent positive of 2.7% was August 3rd. And if you recall, we were in the thick of it then, right after 4th of July. Even sadder than the new cases, yesterday we reported 8 more deaths. These numbers have been slowly ticking up for the past few weeks. And now we've been watching it, and each week we've been watching it, but it's becoming clear now that it is a trend, and it's a trend in the wrong direction, and it's time to course correct before it becomes a real problem. Percent positive last week was 1.6%, and I suspect next week it'll be even higher if we're still on the same curve. Just as concerning, perhaps more concerning, we're also seeing a big jump in new hospitalizations. New hospitalizations last week, we saw a big jump up to 106 compared to the previous week of 67. So in the space of a week, we went from 67 new hospitalizations to 106 new hospitalizations. And you'll note on the screen before you, new hospitalizations arrow is in yellow because we're trying to highlight for you, a warning sign that over the past 4 weeks, we've seen a doubling of our hospitalizations. That's a wake-up call, a doubling of our hospitalizations in the past 4 weeks. And I've been hearing from the folks that run our hospitals, Gov, we're getting concerned. So listen, we are still well below our hospital capacity, well below our hospital ICU and ventilator capacity. So I don't want you to panic because we have great doctors, great nurses, and plenty of hospital beds. But I do want you to be concerned and alarmed and jolted into making some changes because we're on the wrong path. We need to change the path we're on. Instead of being like this, we want to plateau. We know once our numbers start to tick up, we've been through this before, once the numbers start to tick up, it doesn't take long before the increase becomes exponential and then we get into trouble. By the way, you're seeing it in Wisconsin, and I'm going to talk about that in a minute. So, as I've said before, we've been testing a lot recently, and that's why you also see on that we've gone above the 100 cases per 100,000. I was asked about that last week. If it were only 100 cases per 100,000, I wouldn't be as concerned. But the test positive is up, going up, and at an uncomfortable level. The hospitalizations are going up way too fast, and sadly our fatalities are not where they need to be, and we're over 100 cases per 100,000. So no matter how you slice it, we have to adjust. So you probably have a few questions, which is, why is this happening, Governor? Why is this happening? What does it mean? And what are we going to do about it? So give me a minute and I'm going to go through answers to those questions. Why do we think we're seeing it? What does it mean for us? And what are we going to do about it? The bottom line is this. Let this be a wake-up call to us, Rhode Island. It's time to make some changes. We've all, including me and my family, become a little too relaxed, and it's time to jolt ourselves back into more discipline around mask wearing, staying home if we're sick, and social congregations. Okay, so we spent an enormous amount of time pouring through the data to figure out why is this happening. So I'm going to do my best to explain to you why we think it's happening. And I'd ask you please to put the slide up about case trends. The first thing I'll say is this isn't an outbreak like we saw in the spring. In the spring, and even in the summer, actually, outbreaks were being driven by large gatherings, eating out, big parties, etc. That's not happening now. It's actually small social gatherings that are causing our problems. On your screen is a slide showing all positive cases in the state of Rhode Island since September 8th. The top line in black is all of our cases. And you can see that's not a good picture. It's a steep slope up. Really interesting to look at the bottom 3 lines that are flat. There's a red line, a green line, kind of a purplish magenta line. Those lines at the bottom that are flat, look at our cases among colleges and universities, K through 12 public schools, students and staff, and our nursing homes and congregate care. Those lines are flat, actually in some places declining. So we know this isn't schools, not K through 12 schools, seeing no evidence of spread or outbreak, not congregate care, because we are testing like crazy there and managing it. Not restaurants, because they're doing a terrific job, and for the most part, not businesses. In the middle, you see the blue line, which shows all other cases minus schools, colleges, and nursing homes. And that's where all the action is, in that blue line. The blue line has the steepest slope. It's where we have our problem. And we've done an enormous amount of looking at all the data in our contact tracing. Here's the bottom line. We've learned to live with this virus safely in controlled settings. You go to a restaurant, by and large, they're following the rules. You see people have their masks on. It's a controlled setting. You go into a school, the kids are sitting, wearing their masks, washing their hands. It's a controlled setting, by and large. The overwhelming number of cases on that blue line and the overwhelming number of cases spiking up on that blue line is small family and friend gatherings. People who are complying with the limits. Maybe they're only with 15 people, but they're not wearing masks, they're not socially distancing, and their guard is down. By the way, this is what's being seen all over the country. So last week, Dr. Birx came to Rhode Island, and Dr. Alexander Scott and I had an opportunity to sit with her for more than an hour to understand what's happening in America. She came here because she's looking at colleges and universities. She also came here to raise a bit of an alarm bell for New England, because she said she sees in our data exactly what they saw, or similar patterns to what they saw in the Midwest and in the South. It's small social gatherings with people who you know, and therefore you feel safe, and therefore you let your guard down. By the way, I'm guilty of this too. We all are. Think about it. I see it in my family, and I see it in my children. It might be your friend group, your extended family, people in your neighborhood, people who you feel that they're safe because you know them. So you have them over for a dinner party. Maybe there's only 10 people, but nobody's wearing their mask. You're sharing food. You're not social distancing. You're not keeping the windows open. You're not outside. A gathering after church, a gathering after a funeral. This is where all these cases are coming from, and they're going to cause a serious spike if we don't get serious now and change the way we handle ourselves. In your workplace, you have to keep your mask on. You know, with your extended family. And I know this is a pain. I'm probably going to hear about it from my brother and sister tonight. It's a pain when you just get your family together. You got to wear your mask, because these small, social, impromptu, casual events, hanging out at the break room in the office, a small barbecue among your neighbors, these are all the things where we're close together, sharing food, sharing drinks, not wearing our mask. It is the problem. Again, I don't want to be Wisconsin. Hang in there with me for 30 seconds. Let's look at Wisconsin, because they were in a great place and they're in a terrible place right now. So please put the Wisconsin slide up. The point of this slide is when things get off the rails, they can go very badly quickly. Wisconsin was seeing similar to what we were seeing, small, consistent upticks in percent positive. Small, consistent upticks in percent positive. Nothing to worry about until it was. We've been in contact with them, and Dr. Birx shared some of their information. Same problem. Small social gatherings with no mask wearing, no social distancing. It started to add up. Wisconsin saw a 250% increase in hospitalizations in 3 weeks. And in the past 4 weeks, their cases and percent positive have more than doubled. In particular, I want you to, on that slide, look at the location of the blue star on the screen in front of you. That star marks September 10th. That's when Wisconsin had a weekly case rate of 120 cases per 100,000. By the way, that's exactly where Rhode Island is right now. Look at how quickly Wisconsin climbed up the curve right after that. Today, just a month later, Wisconsin has a weekly case rate of 290 cases per 100,000. And today they're opening a field hospital because their hospitals are out of capacity. That happened in a few weeks. So the bad news is, I don't have good news. The bad news is the data that I present to you today is not where we want to be, and we need to make some changes. The good news is we're catching it in time, and it's in our power to put a lid on it so that we don't become like Wisconsin or some of these states in the upper Midwest. We have plenty of time to fix this if we act right now. I have been thinking a lot about this. I have tried to be measured in my response. I don't want to cause alarm unnecessarily. That's why the past few weeks I've been monitoring this, but not ringing an alarm bell. And I've just decided that it's necessary now, which is why I'll be back here tomorrow. We're going to do Facebook Live on Friday. I'm going to be out and about a lot next week. We're going to have some new regulations tomorrow. There is no reason Rhode Island should get into trouble. There is no reason we should have our hospitals filling up. There is no reason we should fly up that curve as they did in Wisconsin. Right now, we can stop it now before it's a problem. But I need to get your attention, and I need all of us to try a little harder and get a little more serious. What we went through together in March and April and May was pretty horrible. We never want to go back there. We don't have to go back there, and we shouldn't go back there. So let's pull together now and do what it takes to control our small informal gatherings with family, friends, church, coworkers, wear our masks always, recommit ourselves to following the rules so we can go ahead and plateau and bend that curve. So I have one specific ask today of every Rhode Islander. Anytime you're out of your house and you're with people, wear your mask and keep your distance. I don't care if you're at your best friend's house. I don't care if you're at your brother's house who lives in the next town just with his family. I don't care if you go invite 2 people from church over to sit with you at your house for a cup of coffee after church. Even if you're with your family, your closest friends, if they're people who you don't live with, I need you to please put your mask on. And keep your distance and stay outside. That's particularly true for our older friends and relatives and people who have underlying health conditions. I need you to, if you are one of those folks who's breaking the rules and having bigger parties than you should, you need to stop right now. If you have planned a Halloween party, cancel it right now. Right now, if you have a Halloween party scheduled, cancel it. And I'll have more to say about the consequences of not canceling it tomorrow. If you're making your plans for Thanksgiving, think about not traveling. This is tough stuff, I know that. We always go to Michigan to see my husband's family for Thanksgiving. We're not going this year. We're at a critical time, and we have to protect ourselves and our state and our economy and our loved ones. So if you're hearing me now, please make a new commitment to wearing your mask and keeping your distance all the time, even with people you know and who feel comfortable to you. And please ask your loved ones to do the same. I think we can turn the trend around. I know we can turn the trend around. Rhode Island's amazing. Look at how well you've done so far, but we have to do it. We just have to get to the business of doing it. We've let our guard down, all of us, and we just have to put our guard back up. So tomorrow at 1 o'clock, I'll be back here to announce some new steps that we're going to be taking to reduce the spread of the virus before things get out of control. Not out of control now. I want to keep it that way. I'm sure you're going to ask, or my friends in the press are going to ask, exactly what are those restrictions going to be? And that's, I will tell you tomorrow at 1, we're still working on it. Let me tell you what they're not going to be. I'm not going to announce we're moving back a phase to phase 2. I'm not going to announce broad changes to clamp down on restaurants and retail and commerce. For 2 reasons. 1, there's no evidence to suggest that that's where the problem is. And 2, people need to keep working. Our economic crisis is as brutal as our public health crisis. I'm not going to be announcing changes to schools, closing schools, more virtual learning. Again, there's no evidence to suggest we have a problem with K through 12. If anything, keeping kids in school is helping us because it's a structured environment. So not going to be big changes to schools. That's not where the problem is. In fact, the test positive rate for kids in virtual learning is quite a bit higher than kids in person. So, and we know there are huge downsides to kids. So not going to see to being out of school. So we're not going to see that. We're trying to think creatively about having targeted, data-driven, effective approaches to clamping down on small social gatherings at work in ways that keep us safe but don't hurt our economy. And that's what I'll say today. For the details, come back tomorrow at 1. We are going to start enforcing with a little more strength the regulations that we put forth tomorrow. Again, because it's important that this is a wake-up call. It's a wake-up call for all of us. And I'm worried about the holidays. I'm worried about Halloween. I'm worried about Thanksgiving. The truth of it is, we've been at this for a long time. We're all sick of it. I get that, but we're not through it yet. So we have to buckle down. Okay, I want to say a word about testing, because testing is going to play a very big role in this next phase. And again, this was something that Dr. Birx impressed upon us last week. We need to really increase the amount of testing we do to asymptomatic Rhode Islanders. And I'm going to have a much more detail to announce about that, either later this week or early next week. We need to start doing more mandatory testing of asymptomatic individuals so we have a better feel for, where the virus is. It turns out we've gotten very good at isolating when we test positive. And I want to thank you for that, because that's really hard, especially if you're not very sick. By and large, people, when they're told they're positive, they isolate. Their contacts quarantine. So that's good. We have our systems in place. The bad news is there's a lot of people out there who don't have symptoms, who are positive, who are out and about, and who are spreading. So that's on us. What we are going to do is come back to you with greater systems for asymptomatic testing. What I will, and I'm going to begin myself to start getting tested on a weekly basis. And I would ask you to think about increasing your own testing if you're asymptomatic. So I want to remind you, you could go to portal.ri.gov, and sign up for a free test, even if you don't have symptoms. So if you're a teacher, if you work at a restaurant, if you work at a manufacturing plant, if you're a member of the clergy, if you went to a party, if you went to a house party or a church party or some kind of gathering last weekend and you were with 10 people and nobody had their mask on and you were sharing food, go get tested, please. It's free. Portal.ri.gov. If you just think you've been around too many people not wearing masks, please go get tested, even if you feel fine. So that's my message for you today, portal.ri.gov. And next week, I'll have more to say around new ways of testing across the population. Okay, I'd like to make an announcement about Providence and Central Falls schools. I'm going to change gears for a minute. At the end of August, we announced we were moving forward with in-person learning, and we set this week as a target date for when we wanted all schools to be phased in to their full reopening. I'm pleased to say, by and large, really by and large, districts have done everything they can to get as many kids in school as often as possible. So thank you, thank you, thank you. Teachers, principals, superintendents, way to go. Been a lot of work, but I think you should be very proud of yourselves. I also want to say thank you to the National Guard and the folks operating our Education Operations Center. The EDOC has been absolutely critical to advancing this mission. At that time, there were two exceptions, Central Falls and Providence. Everyone else was cleared for full in-person learning. We held back for Central Falls and Providence. They're high-density communities with a high case incident rate. We asked them to start with partial reopening. By the way, partial reopening in both districts meant in-person learning would be available to all elementary school students, and that has been happening. That's exactly what we want to see. Our youngest learners, kids with learning differences, English language learners really struggle when they're not in person in school. So we want them to be in school, and that is happening. At that time, we also said that after a month of school, RIDO and RIDE would examine a variety of factors and make a decision for the rest of the semester. And our team, led by Dr. Alexander Scott, spent the last week examining the data. And as a result, we're going to keep Central Falls and Providence in their partial reopening scenario for the rest of the semester. So I hope that gives some clarity to everybody around what's going to happen in those two towns. I want to be very clear about this, what it means and what it doesn't mean. It means we're concerned with the trends we're seeing in the community in Providence and Central Falls. By the way, just as like we are in every community. It does not mean that they've been having spread or a high preponderance of cases in schools in Providence and Central Falls. In fact, they haven't been, and in fact, by and large, the systems are working very well. So in the last month, since we've been open, they've only had 47 cases among in-person learners in Providence and 45 cases among virtual learners in Providence. Only 10 schools have had more than one in-person case. So the safety precautions in Providence are really working. There have been cases, nothing more than we can handle, and no big outbreaks. By the way, I want to say thank you to all the teachers who are working under really difficult circumstances. You're doing a terrific job, and I appreciate it. And to everybody, the custodians are working harder, superintendents working harder. It's a really anxious time, and on behalf of the children, I want to say thank you. In Central Falls, we've only seen 7 cases associated with in-person learning and 9 cases associated with virtual learning. So again, the approach is working in Providence and Central Falls. So we're going to stick with where they are. I would like to take this opportunity, however, to highlight that Pawtucket, although I have a big thank you for everyone who's working hard and doing the right thing, I have a huge disappointment for the school committee in Pawtucket. Why is it that you are robbing the children of Pawtucket an opportunity to learn in school? These kids deserve it. Why is it that they can go, elementary school students are going to school in Providence and not in Pawtucket? They're going to school actually everywhere else in elementary school, but not in Pawtucket. So I'm devastated for those kids and I'm devastated for their parents, and I think it's not fair. So I'm asking the mayor, I'm asking the school committee to step up and lead. I'm asking the superintendent to try a little harder, to be a little more creative, and do what you can to get as many children in school as is safely possible. I know it's not easy. You might be worried about politics. You might be worried about finances. Every other district has figured it out, and I'm asking you to try a little harder because the kids deserve it. And we're here to help you if you want a hand. Two other quick announcements. One, my Commerce Department announced this morning expanded commerce relief, expanded the restore grants, larger grants for small businesses, also an expansion of the program to nonprofits, which we're doing in partnership with the Rhode Island Foundation. So I want to thank Commerce Secretary Pryor and the Rhode Island Foundation. Press release went out this morning. All the details are on the Commerce website. I know businesses are really struggling. The Take It Outside initiative has been a big success, so we're going to continue with that. And again, we're launching more broad relief for businesses. Starting today, we announced it, so please check that out. And then the second thing, the United States Supreme Court ruled that the census will stop tomorrow. I think that's a wrong-headed decision, and it's regrettable. It is, however, what is happening. So if you're out there and you haven't filled out your census, please do it today. Please do it today. Just go online. It takes a couple of minutes. Go online to 2020census.gov, 2020census.gov. Fill out your census today if you haven't, because the deadline is now today. It's not the end of the month. It had been the end of the month. The deadline is today. Fill it out today. Especially now as we're dealing with this crisis, we need every penny of federal money that we deserve. If we are undercounted, that means less money for schools and for public health and for food and for housing. So please take a second and fill out the census today if you haven't. Okay, I know that was a lot. I'm happy to answer questions, but first I'm gonna turn it over to Dr. Alexander Scott.
Thank you, Governor. Good afternoon, everyone. Thanks for being with us today, and thank you in advance if you're able to join us as well tomorrow. We want you to clearly get the message that this is a critical period for us right now. This is our wake-up call. We are sounding the alarm because we can. We can do it ahead of time, and we can stop the trend that we are going in. Information right now is more powerful than ever, and we need you to join with us in doing things differently. To start with our data for today, we have 160 new cases to report. There are currently 131 people hospitalized across the state, 13 people in the intensive care unit, and 4 of those 13 people are on a ventilator. Sadly, as has been mentioned, we have 8 new COVID-19 associated fatalities to report. This brings our overall total to 1,147. 4 of the unfortunate fatalities occurred yesterday. Overall, 2 people were in their 60s, 1 person was in their 70s, 3 people were in their 80s, and 2 people were in their 90s. Our hearts and condolences continue to go out to the families impacted. As we've been doing each Wednesday, we have updated our school's data online. Please go ahead and check that out. As the governor shared, the K-12 community has generally been doing okay. The systems are working. We are not seeing big outbreaks of cases. It's something that we want to definitely continue in going forward. We've seen cases in schools as we fully expected, but our contact tracing and case investigation teams in the COVID unit at the Rhode Island Department of Health have been working around the clock to partner with schools, partner with RIDE, whenever situations have arisen. To school leaders, thank you for your leadership, and I want to reiterate that we are here to partner with you. So when thinking about taking a pause to go virtual for a day or two after having a number of cases, please consult with the Rhode Island Department of Health first. There are limited situations where that may be useful, and many times it isn't needed, and we can support you in how to go forward. So make sure to engage in that partnership. Also, to the school leaders, thank you for continuing to collect the information needed so that we can respond as quickly as possible. We have made general guidance available in our K-12 playbook so that people can be familiar with the roadmap of what happens when there are cases. And we have been working day and night in helping to ensure that people have the information that they need, that the calls that need to be made are being made, and to talk through specifics of the situations with you. I want to really say thank you to the teams of people who have been working tirelessly to help ensure that that happens. It truly is and must continue to be a partnership for us to continue to go forward as effectively as we have been with the K-12 community. Another reminder I want to share with school communities is that if someone in your household has symptoms of COVID-19, then everyone in your household needs to stay home. You should think about your immediate family or your household as one unit. If one child has symptoms of COVID-19, that child and any siblings in the house all need to stay home. If you, as the adult in the household, have symptoms of COVID-19, your kids cannot go to school that day. This is also applicable when it comes to work. If your child has symptoms of COVID-19, you cannot go to work. If your partner or spouse has symptoms of COVID-19, you also cannot go to work. This is what we refer to as quarantining. As a close contact, you're with someone who has symptoms, you need to stay home, not go to school, not go to work. That's because it can take time for symptoms to develop. You could have COVID-19 without knowing it, and it can take as long as 14 days for symptoms to surface. And a clear way to stop transmission from occurring out in public is if one individual in the household is sick, the other individuals in the household should stay home until there's further information about COVID-19 and what needs to be done. I know this is not easy, but we need people to take these steps if we're going to continue limiting disruption to schools and workplaces. And we know that it is possible. As the governor said, it's when we have those structured environments, we can continue living with COVID-19 safely. While we're not seeing significant clusters, widespread cases in the school community, as the data show today, we know that we are seeing it as a state on a whole at the community level, widespread community activity. And that's where we're sounding the alarm and want to have you take steps differently. Since we were here last week, our daily case numbers ranged between 80s a day to more than 250 new cases in a day. While those numbers need to be considered alongside the increased number of tests that we're doing according to each day, those numbers of new cases in general are way too high. And knowing that it's in the community, it's not so much in K through 12. It's not so much in the congregate care. We need to act now about the community spread that we're highlighting. In our case investigations, we're seeing the same pattern time and time again. It's the pattern that the governor described. While we have done relatively well wearing masks out in public settings, people need to do better. If you're out and about, you always need to have your mask on. The added change now is also wearing masks in our comfort zones, in more familiar environments, when we're engaging with people that we know, family members, friends, coworkers. Those are scenarios where COVID-19 can still be transmitted, and that's where we are saying you need to continue to wear your mask in those settings. Even if it's someone outside of your household that you see every day or on a regular basis and you feel, oh, it's safe, they're not going to have COVID-19. That's exactly the time we need to continue to wear our masks. People are generally doing the right thing when around strangers in public in terms of mask wearing and distancing, but when it's around people that you know, that's where people are letting their guards down. And the whole point today is talking about bringing those guards back up. We need to stop transmission from occurring in those familiar associations scenarios. That's the people who are not complete strangers to you. On the one hand, they're your colleagues, your family member, a cousin, a neighbor, or anyone else you see regularly. That familiarity exists and is giving people a false sense of security. That's the shift that we need to make. COVID-19 does not care about that false sense of security. While people's guards are down, whether eating, relaxing, talking, their masks are not on, and the case counts have gone up. It's as simple as that. We need masks on to keep case counts down. We need to be wearing masks when we are around other people who we do not live with. That's true even when we're in our own homes. If you have a relative over, if grandma or auntie or uncle is visiting, you both need to be wearing masks and keeping a distance. We need to figure out how to socially interact with each other in a COVID-19 safe way. And that means wearing a mask even in those familiar settings. That's the change that we need everyone to get on board with doing. Transmission is happening in informal, connected settings between people who know each other. And it's a glaring trend that we're seeing in our case investigations right now across the board. The governor shared the different scenarios already. It's whether it's with your coworker in the break room, with a family member in the house or in the yard, or with a friend or a loved one after a funeral or some form of life milestone celebration. In each of those situations, we must continue to wear our mask. COVID-19 does not care if it's an informal or connected setting where you know someone. And oftentimes, people do not have symptoms. That's what the key is, particularly younger members of our population, 20s, 30s, 40-year-olds. You may not have symptoms and have COVID-19. That's why we have to make this shift immediately now. If everyone can start doing this now, today, we can stem the tide. We have to stem the tide. For our most recent week of case investigation data, there were 1,033 cases identified. And to continue to share what else we're seeing in real time, of the people who were employed and who were positive or who tested positive for COVID-19, 60% still went to work at least one day with symptoms. That number is entirely too high. I'm telling you that a large proportion of people may test positive for COVID-19 and not even know because they don't have symptoms. Certainly, if symptoms are present in any way whatsoever, you need to stay home from work, you need to stay home from school, and anyone that lives in your household needs to do the same. There are supports available for people who cannot go to work. We recognize that that's challenging. It's financially challenging and otherwise. We want to provide the resources and support for you, because if you go to work sick because you need to, the challenges that can come from more people getting sick can be even harder than being able to stay home. So for more information on resources that are available to you, whether you're undocumented or someone who is unemployed or someone who is older and living by themselves, call us at 401-222-8022 so we can continue to get the resources available to you. The most important thing to remember is if you're experiencing symptoms, please stay home and make sure the members of your household do the same. The last thing I want to touch on before opening it up for questions is businesses and bars and restaurants in particular. The vast majority of businesses in Rhode Island are doing a phenomenal job serving customers in a way that is responsible and safe. I give kudos to you. We are grateful for that, and I'll reiterate what the governor said. Most of our spread is not happening in the retail and business community because of the structure that you have in place and the strong work that you're doing following your COVID-19 plans. To those business owners and to the employees at those businesses, thank you. However, I have to point out that there are some bars we are still seeing issues with. We no longer have the luxury of being patient with people who are putting others at risk by not following the rules. Since I was here last week, we issued immediate compliance orders to 4 bars because they were blatantly disregarding the Rhode Island's COVID-19 requirements. These orders temporarily closed those establishments completely. We have to be aggressive right now. We found bars operating after 11 p.m., mingling customers being served at bars, a failure to maintain separation at bars, and employees and patrons not wearing masks. Those are all of the examples that contribute to the increase in cases that are occurring. We need to wear masks. We need to keep our distance. Although restaurants can operate bars, they must close by 11 p.m. And patrons must be seated at bars with barriers between seated parties. It's that structure that decreases the risk of transmission. And nightclubs cannot operate in Rhode Island at this time, period. A business owner that's not following the requirements is hurting their entire industry. It's also jeopardizing the safety of customers and communities, and it's a small number of people. It's setting the whole state back in our work to prevent the spread of the virus. We are at a moment in our response to this virus when we absolutely need people following the rules. We will be back tomorrow, continuing to provide more information. There can be tip lines and ways that you can contact us so that we can all work together to make sure that we're following the rules out in public, as well as in our more familiar settings with loved ones, coworkers, and friends. It's about wearing that mask. That's how we can stop the transmission and keep each other safe. Let's get started with questions.
Doctor, is it safe to go trick-or-treating? Are you going to force people to get... Is it safe to go trick-or-treating?
We want people to think of more creative ways to celebrate Halloween. There are options that people can do with kids, get them costumes, allow them to have bowls of candy throughout their house, do Zooms and other ways to engage. With that being said, we're going to be back tomorrow with other safe ways to allow kids to celebrate some of this, but to pay attention to what we're seeing with the numbers and make sure that we are monitoring that carefully.
Does that mean no trick-or-treating?
We'll be back tomorrow with more details.
Governor, did you say that you're going to be tested weekly?
Yes.
And what prompted that change? How often have you been tested until now? And we know you were tested after you said that you were tested after the protest in June. How many times have you been tested through this?
So I've been tested 3 times, and we're going to start this week on a weekly cadence because that's what the doctor recommends. And it's part of a greater effort. I know I feel fine. I have no symptoms. I'm extremely careful, but it's part of what we're talking about with more asymptomatic testing. So I'm trying to lead by example, and also it was recommended that public leaders consider having more testing given the positions that we're in.
You said, just to follow up on that, if I might, do you think that everyday people should be tested frequently, asymptomatic testing?
Yes. So we're going to come out, again, we're going to come out next week, hopefully early in the week, if not by Wednesday, with a new system of mandatory testing for asymptomatic people. It doesn't mean every Rhode Islander is going to have to get tested every week. That would be impractical, not that useful, and incredibly expensive. But like when we talked to Dr. Burks, she said, what about if you test, for example, all commuters to CCRI and RIC on a regular basis? Like what we're trying to do is test enough asymptomatic Rhode Islanders frequently enough so we get a feel for where the community spread is. So that's what we're trying to figure out.
Governor, you're saying mandatory testing of asymptomatic people. Are you going to force people to get tested who don't want to be tested? That's what people are hearing.
So
and how can you do that?
We can't really. You can't. You offer it. It's like I was saying to Steve, I would never suggest that everybody have to get tested every week, as I am going to be. But it's exactly what we've been doing in nursing homes for months, which is working. We offer it to every resident and every worker in every nursing home on a regular basis. So no, you can never force anybody, and we would never try to do that. But we would offer it, we would make it free, we would make it easy, and we would do it on a regular basis.
We're talking like teachers?
Maybe. We're still figuring it out. Maybe.
And along the civil liberties front.
And the reason for this is you don't want to have just the worried well, right? You want the worried well. Like in other words, people who on their own choose to go get tested, that's a great thing. So today I'm asking you, go to portal.ri.gov and go get tested. If you're a teacher, if you're a hairdresser, if you had a party last weekend, go get tested. But we want to try to have more systematic testing, just like we've done in nursing homes, of enough people in Rhode Island so we get an accurate picture of how much virus there is in the community. Does that make sense?
On kind of the civil liberties thing, and I know tomorrow you're going to have more announcements, but you're pinpointing small family get-togethers, people with friends. How do you enforce that? People are thinking like, are the cops going to show up now if you go to your mom's house to go have dinner? I mean, how do you realistically enforce rules on small gatherings if you're just going to visit a friend?
Yeah, I shouldn't laugh because it's serious, although I had an image in my head. We're not going to do that. We are not going to send the cops to people's house. I'm going to ask people to do the right thing, and I'm going to have faith that they're going to do it. And I think that they will, because that's how we've gotten to where we are. I don't think anybody's trying to be malicious. I think everybody's just gotten too relaxed. Having said that, and I'll be back tomorrow, big parties, Halloween parties, big social gatherings, bars that don't close and allow congregating, there will be enforcement for that.
Governor, you mentioned that hospitals had expressed to you that they're concerned. Are we at the beginning of the second wave here in Rhode Island? And it kind of feels like we're back in the spring as far as the tone of this press conference today. So what are the new metrics, the new trigger points that will possibly set us back into phase 2 have some sort of relapse into a lockdown? What are you hearing from inside the medical community about the status quo and where we're headed?
So there'll be no new metrics. We've spent a lot of time on our data, and these are the metrics we're going to follow. Test positive, cases per 100,000, hospitalizations. We know what we're doing. It is not the spring. It is not the spring. We're testing 10, 11, 12, 13,000 people a day. We know we have hundreds of people doing contact tracing. We are, honestly, I feel concerned about the data, but I feel very good about our systems because we have the data. Like she said, she's done case investigations for 1,000 people in a week. We have a good handle on our problem right now. We didn't have that in the spring. In the spring, we didn't know where the virus was, how much virus there was. We have a handle on our problem. Our problem is these unstructured, informal social gatherings with people who and we are not following the rules. So we are not going to go back a phase. There's nothing in this data that makes me think we have to. What I'm here saying is, if we don't change, then we'll go back a phase. Look, if in a month from now, people haven't heeded our warning and we look like Wisconsin, then we'll go back a phase. But why will that happen? To Brian's question, like, everybody, come on, listen up, make a change, do the right thing, flatten the curve so we can keep going to work.
Are we still seeing the same trends with respect to congregate care settings, particular zip codes, et cetera, in the state that we saw in the spring, or are we now
No.
to the point where that's not reflective of the status quo?
That is not. In fact, if you look at this slide, which was up on the screen, things are looking pretty good in congregate care. It's actually declining in congregate. It's very sad because too many deaths are resulting because these are vulnerable people. So I don't mean they're looking pretty good. What I mean is we're testing regularly, we're isolating, we have it under control in congregate care. We have it under control in K through 12. We're getting under control in colleges, not quite there yet. We have like broad community spread in the community. And so that's why we have to do more testing to figure out where are sick people and getting asymptomatic people into isolation. That's our problem right now. People who have the virus, who don't feel sick, who aren't taking any precautions, and they're getting others sick.
Governor, good afternoon.
Hello.
Shifting gears a little bit, you've distributed just over 20% of the aid for small businesses, and I know Stephen Pryor's moving into a position here. Would you consider that 20% a successful program so far? Over 8 weeks, only 20% going out?
I would say it's 1,400 businesses, and for them, it's a success because we've heard from them, thank you, we'd be closed otherwise. It's not as fast as I would have hoped. I would have liked to have seen it faster, which is why today we announced an expansion of that initiative, Restore RI? Yeah, I lose track of all of it. Restore RI, we're going to double the amount that businesses can be eligible for. We've expanded it to sole proprietors, expanded it to childcare, and we're expanding to nonprofits. So is it a success? I judge it an incomplete. It's a good beginning, but there's more to do, and I wish it were going faster.
So it's been 8 to 10 weeks since you announced that in the application process. You got 11 weeks till the end of the year. And that coronavirus money sitting in an account right now. And you've been telling us for 5 months that you hope that Congress will, in your words, do the right thing.
Yeah.
They haven't done so far. The House isn't even in session. The Senate's preoccupied. And if the Republicans do lose the Senate, if Mitch McConnell for some reason loses it, I don't think they're going to be in a mood to give the Democrats what they want. So under that total picture, first of all, are you confident that you're going to be able to get more money out the door of what you allocated? And why not consider putting more out the door now? What if you lose that money at the end of the year? You've been sitting on it. It's got to be used, and Congress does not act.
Yeah, you're asking all the right questions, which is what makes my job tough right now, because I'm trying to balance all of these interests in a sea of uncertainty. I talked a week ago to our congressional delegation and the Treasury Secretary, who are feeling reasonably confident that the year-end deadline will be extended. Reasonably confident that we're going to have to use some of our coronavirus relief to balance our budget. I don't have a crystal ball. I do know businesses are suffering, so we put more money out today. And we're going to work like crazy to get all that money out to the businesses that need it. The election is a few weeks away. We'll see what happens. We're not going to give the money back. I'll tell you that. We will figure out a way to get the money into the hands of Rhode Islanders by the end of the year, if that's what I need to do.
Just one final follow-up. I heard from a wedding planner in Newport, and this industry has just been decimated.
Yeah.
And she got $4,200 out of a potential maximum $15,000. She's lost tens of thousands of dollars.
Yeah.
So you have put out the call, be creative. They've talked about Connecticut, Massachusetts are 100 people. They're limited to 50 indoors. They want to know, and I know despite these numbers that are coming out today, they were already planning for 2021. They're talking about possibility, what about going up to 100, it's a controlled setting, and doing testing 72 hours in advance of the guests coming in.
Mm-hmm.
So they want to have that dialogue with you, and what they heard last week when you said that vaccine is what really set them off. Because what they heard from you is, I don't think we're going to be able to move to larger numbers until maybe we have a vaccine. So can you speak to that, to that industry?
Mm-hmm, definitely. And by the way, we're trying to engage with the industry, and I'm going to actually be spending more time myself talking to people because I hear from them, but I want to have like a structured way to hear what's going on in people's lives. What I referenced, I was thinking more like the convention center. So big gatherings. Not a 100-person wedding. I cannot, in the position we're in right now, in light of the numbers I just went through, contemplate any expansions for indoors. But it doesn't mean we won't at some point, certainly before a vaccine.
Well, what about that potential testing? And
It's a good idea.
It's a controlled.
It's actually a good idea. Give me the good ideas. Every good idea. You've given me a few. They're not yours, they're other people's, but the voice that you give them. And we've pretty much followed up. So, we'll think about it.
Governor, let's elaborate on that point for a second. When you talked last week about vaccine, I think the words were something to the effect of not a silver bullet.
Yeah.
When you combine that with statements that have come out of your media office about a holistic approach to testing and an evaluation of where we stand in light of today's crisis, and when you add to that no organizations, none other than WHO, have come out and advocated for stepping away from these type of lockdowns that we're still to a degree involved in right now. When will the governor's office decide on a standard that will essentially end these type of lockdowns? People see this right now. We've gone from flattening the curve to an elongated, murky process that may never end.
So we don't have a lockdown. 90% of our economy is going. We can go out for dinner. People are largely going to work. Our kids are largely going to school. The restriction, to be clear, is, Hummel and I were just discussing. I know there's restrictions, and I know that's hurting people's pocketbook, and I'm sorry about that. But we're not in a lockdown. What we're in is a reasonable, targeted set of restrictions that are narrowly tailored and designed to save people's lives. And actually save people's jobs. Because if we were to get into the Wisconsin, South Dakota, North Dakota territory, more people would be out of work. So it's not a lockdown, and I think they're a reasonable set of restrictions.
Having been raised Catholic, I'll use the term purgatory. We're not in a lockdown, you're right, but we're also not in a position right now where businesses can reasonably expect to attain a profit if they're anywhere near the hospitality space. And given Rhode Island's economy heavily leveraged towards healthcare and the hospitality space,
Yeah.
we might as well be in a lockdown for some businesses.
So, no, I would say two things. Purgatory is on the way to heaven. So, going along with your analogy, we're going to keep going with that, and it's better than the alternative. So let's keep going. Let's do the right thing, follow the rules, and get ourselves to the right place. And that's precisely why we're putting out more commerce relief today, which I didn't have time to go into. Some of it is specifically targeted at hospitality and hotels, because we know they're most struggling. Some of it is specifically targeted at culture and arts. And we just put it out today. So, because I know they're struggling, and you're right, we got to get it out the door.
Governor, can you explain again why Wisconsin is being used as the model? Simply because they're a much bigger state than we are. Yeah. And you have a state like Florida that is like wide open. So what is it about Wisconsin? I think their population is 6 million compared to Rhode Island.
Yeah. So that's a good question, and I felt a little bad picking on Wisconsin, but I was trying to I've gone through all the data, and what's happening there is similar. They have mandatory mask wearing. They had been on a pretty good plateau. And then they started to see small increases in percent positive, like us. And then within a matter of 3 or 4 weeks, all of a sudden they were in big trouble. So it's not a perfect analogy, and I probably could have picked many other states, but it's similar enough, and I don't want to go down that path. Basically, my message is, and this is me, this is my decision. I know enough now in this data, I know the road we're going down, and I want to take a turn and avoid where we're going. And as I looked through Wisconsin, it felt pretty analogous.
In regards to Massachusetts, have you spoken to Governor Baker? Do we remain on their travel ban?
Unfortunately, we do, which is a disappointment. By the way, they fail their own test. They would be on their own travel test. They'd be on their own travel list. Thus far, I could not get him to budge. By the way, they're starting to go up the curve. Connecticut, I talked to the governor of Connecticut yesterday. They're having this doubling of hospitalizations. They're at 2.5% positive. So I'm trying, but I have not succeeded.
Have you spoken to Governor Baker since we learned an intruder got into his home? And then we've also heard about 2 Democrat governors, the governor of Michigan and also Virginia, that were then threatened in some way. Have you?
I haven't talked to him about it, no. It's an anxious time for governors, though. I mean, there's a lot of chatter among us.
Governor, you were really adamant that students should be in school. Obviously, you set October 13th as the expectation. That hasn't come to fruition. Providence and Sioux Falls, as you mentioned, still have to stay hybrid. What's your response to that expectation not becoming a reality?
Well, I think maybe I misheard you. So a month ago, we said we would evaluate this week. And by and large, you know, most districts are back in person. I suppose it would have been nice if we could have said Central Falls and Providence, you also can go back full in person, but in light of everything we're talking about here, it just felt like they ought to stay where they are and continue to operate where they are. It just felt like the cautious thing to do.
One last question for Dr. Nicole Alexander-Scott. The 4 bars that were closed, one of them was issued an immediate compliance order from violations that were found 6 days prior. If it was such an immediate threat to the public there for the violations they received, why wait 6 days to tell them they must close and remedy these issues?
Yeah, we worked with them immediately to respond to and correct the issues that were at hand. And without seeing those improvements, we moved forward to the ICO. Given these conversations, we're absolutely going to make sure that they're facing the consequences if we don't see the change needed.
Doctor, can I just follow up on her question of, if you were the governor of the Peace, Professor Emily Oster of Brown University in the Atlantic, that schools are not the super spreaders. The governor's nodding her head, so either one, but not the super spreaders that we believe they were going to be. And does that impact your guidance to the Rhode Island school system?
Yeah, it allows us to continue forward the way we have been saying. The systems are working. The schools are doing a good job. Providence and Central Falls, we were able to say there isn't a need to restrict further because they have done a good job in keeping the cases contained, in working closely with us to respond in getting people quarantined when they need to or isolated and otherwise. So our understanding of how transmission occurs and the fact that schools are not the place where super spreading can occur along with knowing that the systems are in place. We're far ahead as a state in having the K through 12 testing system that's set up and allows for that rapid turnaround. Our ability to have the partnership with the Department of Education and the Education Operations Center, and an amazing team of heroes to me in our COVID unit, EpiOps, working tirelessly late into the night to make sure that people are called and they get the information. All of that comes together to say in-person learning is where we need to continue to push for our schools, and the article that you referenced only helps reinforce that.
And just quickly, in that article, Professor Oster mentions that for low-income children, it's irreparable damage being done. And the governor mentioned, you have Pawtucket that is complete distance learning.
Absolutely. And we can only reiterate what the governor called out to Pawtucket to get in line with what all the other districts have figured out, and knowing that it's critical for our children across the board from every community, in particular for those communities that historically have had less resources available to them that they need. We need to make sure that we give those kids the fighting chance that they deserve, that the families deserve, and we're doing everything at the state level to ensure the safety for teachers, for families, and the students to make that happen.
Doctor, I'm sorry.
I'm familiar with her work. The piece was great, and yet the answer is yes, it is impacting my thinking, because we're trying to be just data fact-based. So she looks at the data, and she's a, I guess, statistician, economist, and concludes that there's no evidence to suggest spread in K-12. There are other studies, which we've read, you probably have too, we can share them with you, that look worldwide at K-12. And there's actually no evidence worldwide of real spread in K-12. So when you weigh that against the fact that children could be irreparably harmed, although these things are really tough calls, on balance, we got to get the kids in school. And as I already said about Pawtucket, it's a poor community. Parents have to work. Kids are stuck at home alone. And so that's why I have felt the way I felt. By the way, we've seen about as many cases of kids with coronavirus who are learning virtually as the kids in schools. So it's not like letting the kids learn from home is the answer, because it's roughly 50-50.
Just because at the end of August, I mean, we all watched the protests, the teachers making out their wills, the driving around, and her article in The Atlantic, none of that has proven to be true.
Correct. Thank God, by the way. I'm really happy. I mean, teachers are working really hard.
Governor, I mean, you still have teachers who are openly complaining that you're putting teachers at risk and students as well, despite all of that. They're listening to what you're saying and say it's not true. They look at any cases in schools, hundreds of cases in schools, cases in more than 100 schools as a problem.
Yeah.
Why don't you see it that way?
So first of all, listen, I feel for teachers. It's really hard. It's always hard to be a teacher. It is really hard to be doing it right now. And they're doing a great job. By and large, they're showing up every day, working under difficult circumstances, being creative, and getting it done for our kids. Having said that, I mean, look at, everybody's been, it's hard to be a bus driver. It's hard to be a police officer. It's hard to be a nurse. It's hard to be a CNA in a nursing home. So we're doing everything in Providence, you know, we have a custodian on every floor of every elementary school, cleaning regularly. We're offering the testing. We're requiring children to wear masks, which was asked of us by the teachers. So I hear you, I hear them. I don't want to diminish the concerns, and we're going to try even harder to meet their needs. But just like, look at the facts. There is no widespread spread, and the kids who are at home learning are getting sick at the same rate, actually at a higher rate.
I asked this a few weeks ago. If you get Dr. Alexander Scott, who is getting hospitalized? Are you seeing any of that among school-age kids or college kids yet? I know that wasn't the case before, because you also mentioned that nursing homes and congregate care settings have not been as much of a problem. Where are the hospitalizations and now the rising number of deaths coming from? Are those people who just got together with family members?
No, we are not seeing significant hospitalizations in K through 12. Nothing has persisted. Within our colleges and universities, there were 2 hospitalizations for sort of routine consequences. People went home within 24 to 48 hours. Unfortunately, what's happening with the hospitalizations is what you anticipate with COVID-19. When there is increased spread throughout the community, you have the same population of people who have underlying illnesses or who are older, more frail, elderly, who are at risk of developing complications of COVID-19 that require hospitalization. They end up also being in the hospital longer, the recovery time takes longer. So that's what's leading to the slow increase in hospitalizations. And that's exactly what we can put a stop to by people masking in their more familiar environments, in addition to the masking in the public settings that we all need to make sure we're doing better.
And Governor, sorry, just one more thing on the schools. We've been asked, I know you got asked this about buses a couple weeks ago. What do you tell people who are in classrooms, the windows are going to be open, it's getting colder now, just bundle up, or what's the plan?
Governor, I just got a message.
Could you just answer that at the podium, Governor?
Yes, for now, the answer is bundle up, because we know it's safer and we know that's the best thing. And we're in the process of purchasing HEPA filters and air purifiers, and we hope that we have a better answer in December. Would you call on?
Thank you. I have a question best answered by the doctor. I'm interested in, you said that the governor met with Dr. Birx, and there was discussion earlier, I think it was from the governor, about the distinction between controlled and uncontrolled environments. That it's a controlled environment is something like a school or a workplace where you can screen people coming in, and an uncontrolled environment would be something like a family gathering. And interesting, I wrote an article about that on latifrei.com a couple of weeks ago, trying to explain the distinction as to what happens in terms of prevalence. And so that's all driven by the prevalence. How common is the infection in those populations? And so the goal in a controlled environment by pre-screening people is to keep the prevalence down, to keep the number of infected people, the percentage of infected people much lower in the controlled environment than in the uncontrolled environment. But that leads to the question, what is the prevalence? And I think we don't know that, is what I'm hearing. And in fact, that Dr. Birx was expressing concern that we need to do more testing and measurement to try to extrapolate or determine what the prevalence is. And so what is the Department of Health's view at this point of what the prevalence is? I mean, obviously you can make guesses based on positivity of testing and so on. But if the CDC is right and their best guess is that 40% of total infections are asymptomatic, that would drive your estimate. So what are you seeing? How close do you think that is? How many people out there are asymptomatic and don't know to isolate, or don't even have symptoms significant enough to make them think that they have an infection? And what can the state do to at least try to narrow down that number?
What we're doing to identify prevalence is picking subpopulations of people to get the type of asymptomatic testing that will allow us to at least understand what's happening within that community. That's been a key component of our response with the Institutes of Higher Ed. We know that there had been an increase in cases. Very quickly, as a part of our outbreak management, do a full point prevalence testing schema of the particular student body, understand where the people who don't have symptoms are transmitting COVID-19, get them into isolation, and any of the people who are around them quarantined. That's the most effective way for us to wrap our hands around this. A big piece of what we'll be bringing back to everyone is how we can continue to get those targeted point prevalence assessments of certain parts of the population. We'd need unlimited resources to be able to test the entire population on a weekly basis. And so we're taking the expertise, the data, and the science to help inform where are the best ways for us to capture an understanding among the 20, 30, 40-year-olds that tend to have a higher proportion of them who are asymptomatic, allow us to identify those people who don't have symptoms, get them into isolation, and the people quarantined.
Well, no one is suggesting, of course, that it would be reasonable to test everybody on a weekly basis in the entire state. But from a statistical sampling point of view, you must have some idea of a number. At this point, what is the prevalence? Do you at least have a range?
Yeah, we are calculating that. We're basing it on what the CDC has suggested as well. And I'll reserve that. We'll come back to you with what our latest estimates are as we're making the shift in the updated asymptomatic testing approach.
Results for asymptomatic
Real-time question. I
people,
just got a
what
message
their
from a
percent
member of the
positives and
General
negatives
Assembly
are in total
that-
tested.
So
I just got a message from a current member of the General Assembly, Governor, that said they refused to cancel their Halloween party and their Thanksgiving plans. So how do you enforce all this stuff that you're saying if a seated member of the House of Representatives is saying publicly they refuse?
Who?
This is Representative David Place.
Again, I'll be, you're gonna get me again tomorrow, so I'll be back tomorrow at 1. I'm gonna go through all the new restrictions and all the new enforcements. By the way, we're still working on it, which is why I need another day to get to it. But as a leader, he ought to do the right thing, because if he cares about the businesses and small businesses in his community, then this is the right thing to do. Because if we don't, then we're gonna have to shut down businesses. And like, why would he want to be part of that? But give me a day and I'll give you all the details.
Doctor, can you get us, and I don't mean right this minute, of course, but breakdown of testing data, positive, negative, total test, percent positive, further broken down between symptomatic and asymptomatic patients?
yeah, so we have an excellent data dashboard, the Rhode Island Department of Health, that I want people to check out because it allows us to help understand. I'm going to make sure that you connect with Joseph afterwards so that we can dig a little bit deeper of what's available for asymptomatic versus symptomatic. We primarily have it in those populations of groups that I referenced, whether K through 12 or colleges and universities or congregate settings.
Thank you.